Go red in February. Heart patients stand up to a new cardiac chair. And which state's residents are most prone to heart disease? These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. If you're in the red this February, that's a good thing. February is Heart Health Awareness Month, and it's time to know what's what when it comes to your ticker. Heart disease is a generic term that describes several problems related to plaque buildup in the walls of your arteries. As plaque builds, your arteries narrow, making it more difficult for blood to flow. This can increase your risk of heart attack or stroke. The other types of heart disease include heart failure, heart valve problems, and an irregular heartbeat. If you have a heart condition, you can partially blame your family tree, but lifestyle choices play a big part in it too. Fatty foods, lack of exercise, high blood pressure, diabetes, smoking, and stress are all factors in your heart health. Heart attack is one of the most common forms of heart disease. Each year, about 935,000 Americans have a heart attack. In a survey by the CDC, 92% of people know that chest pain is a warning sign, but didn't know there are other red flags.
Chest pain is one of the primary symptoms, as we would say, for angina, heart attack patients. They may present with shortness of breath, they may present with neck and jaw pain, and quite a few of them would have just a general sense of fatigue or weakness preceding the actual onset of the heart attack or the chest pain. So these are some things to be taken into consideration when we are dealing with all patients, and especially our women folks.
You can survive a heart attack, and thanks to Sinai-Grace Hospital's Cardio Team 1, your chances of returning to a normal lifestyle are increased.
Cardio Team 1 is a program that enables the interventional cardiologist to live in the hospital for the duration of his call, allowing easy access, immediate access to the heart attack patients, early and prompt evaluation for patients coming in with chest pain / atypical symptoms of angina, and they would get immediate access to an interventional cardiologist who has trained and is fully capable of providing immediate access with necessary cardiac catheterization and angioplasty if needed.
For more information on Sinai-Grace Hospital's Cardio Team 1 or to reach a cardiologist, call 313-966-4800. Are you sitting down? If you're a heart patient at Sinai-Grace Hospital, your healthcare team might get you in a cardiac chair to help speed your recovery.
The cardiac chair is what we've been utilizing in the ICU to help promote our progressive mobility protocol. A lot of times you would think that an ICU patient wouldn't be able to get up and assume certain positions that you and I can assume, but that's not the case. And lots of research has shown us that the earlier you get your patients mobilizing, the much more dramatic outcomes positively that you'll find. So here we have a patient in our cardiac chair. When they first get on here, we slide them on from the bed and they assume this stretcher position. And what's great about the cardiac chairs, you're able to assume a reverse Trendelenburg or a full Trendelenburg position just by the push of a button. And according to how well they tolerate moving, we can assume a full 90-degree chair position. And secure them safely with our safety belt. And then from there, our hope is to reach a goal of then standing by utilizing these rods. So far for the patients, I'm sure that For them, it feels really good to be able to sit like a healthy individual could sit again. Sometimes they can only tolerate a little bit, but for us, we see highly improved outcomes just in our research. You see a lot of decrease of extended disability with patients outside of their experience in the ICU, and you see a lot of decrease in mortality with the earlier you mobilize your patients.
Sinai-Grace Hospital is also leading the way in a breakthrough imaging technology that can help better detect heart, head, neck, and other vessel conditions.
We're really excited about this Toshiba biplane here at Sinai-Grace Hospital. This recent model gives us the ability to do CAT scans while the patient's on the table. It allows us to perform our endovascular procedures. We can have a better visualization of the blood vessels and the anatomy of the patients with this machine, with a decreased amount of radiation for the patients and using less contrast on the patients. Normally from femoral access, we can navigate through the blood vessels up into the blood vessels of the neck and the brain, shoot dye, take pictures to diagnose such conditions as stroke, aneurysms, arteriovenous malformation. In the acute setting, when a patient is having a stroke, we can have selected treatment options where we can actually remove clots from the brain. If there's an aneurysm rupture, we can place metallic coils into the aneurysms and thereby excluding it from the vasculature, so no blood can get into the aneurysm and then it cannot re-rupture. With this newer technology, we have better resolution, and with that, we can perform 3D rotational roadmaps, so we can advance our catheters in the right positions, so we can treat the patients in an efficient manner and treat them quicker. The quicker we get to the thrombus and remove it, the better off the patients. So with this new technology at Sinai-Grace, I believe that we'll be able to treat our patients more efficiently and more effectively.
For more on Sinai-Grace Hospital's heart imaging capabilities, or to reach a Sinai-Grace Hospital cardiologist, call 313-966-4800. Oklahoma may want to rethink its state meal of fried okra, barbecue pork, sausage, gravy, and pecan pie. People who live there rank the worst for heart health conditions such as high blood pressure, diabetes, high cholesterol, smoking, a healthy diet, and regular exercise. States in the South followed closely, while Washington, D.C. residents topped the list for good cardiac health. A proper diet is an important factor in your health and wellness. Lesley Harding reports on how calcium and vitamin D from the foods you eat play into bone density.
While a lot of time and attention is spent on things like heart health, diabetes, cancer, and other conditions, don't forget about your bones. As we age, we lose bone density.
So the main factor is aging. As we grow old, after middle age, we lose about 2% of bone mass every year. And this occurs more commonly in females, especially after menopause. The other factors are lack of exercise and lack of dietary calcium. Also, there are uncommon factors such as long-term medication use, such as steroids and thyroid hormones. And there are some diseases of bone marrow which affect the bone mass, and these diseases are like multiple myeloma and leukemia. So the most common consequence is increased tendency to sustain a fracture, and when this happens in spine or hip, that leads to severe disability.
The easiest way to determine your bone mass is through a bone density test.
This test is mainly indicated for women who are older than 65 years. Then there are people who have low dietary intake of calcium, the people who sustain fracture after a minor injury, the people who have history of smoking and heavy drinking. These are the main persons who need this test, and it is recommended at least from 2 to 5 years.
If you have bone loss, here are a few things you can do to prevent further loss.
The main factor in preventing bone loss is regular exercise. And we can also give calcium and vitamin D supplements, and there are some special medications which will help in increasing the bone mass.
To make an appointment for a bone density test at Sinai-Grace Hospital, call 313-966-4800.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. Also, log on to pagingdredie.wordpress.com for great health information. I'm Melanie Moss. Thanks for watching.